A major medical center in the heart of Chicago's South Side goes on bypass. Why it's happening and what it could mean for patients. Right now in Hyde Park, more than 2,000 nurses at the University of Chicago Medical Center say they will strike first thing tomorrow morning and stay off the job because of hospital rules, at least until talks resume next Wednesday.
Now at this hour, the hospital itself is on bypass, telling ambulances to take sick and injured people somewhere else. The nurses say they're overworked because of chronic staffing shortages. The hospital says staffing numbers are some of the best in Illinois. It's hospital rule that if they strike, they have to stay off the job for at least 5 days. Now, union workers say they're essentially being locked out. In preparation, the hospital is already on full bypass, sending some patients to other medical centers. Negotiations broke down yesterday. This morning, both sides are standing firm.
Right now, there are times when nurses take care of more patients than they safely should be taken care of. So what we want are things like that not to happen.
As we really made a generous proposal around that, recognized as a generous proposal by the union negotiator, she put additional things on the table as core issues, and it was clear we're so far apart on those that both sides determined there was no more productive conversation to be had.
Albert says the main additional issue is compensation. She says the UFC nurses are the best paid in the city and state. Nurses plan to be out on the picket line by 7 o'clock tomorrow morning. We'll be out there, of course, with live reports.